And what we looked at for building our model was to base it on the Kaiser Permanente model. And I know all of you have seen this, certainly this diagram before. But what we looked at was developing a model that would have programming along the whole continuum of care. And so when we look at our project, we've really looked at incorporating research-based evidence practice into our model. And our objective really was to create a way that our programming could be incorporated to the already existing programming. So it wasn't to develop a whole new system, it was really to support the system that was already in place and looking at how do we incorporate the falls prevention component within that system. We're really trying to engage our providers and our partners to look at what their responsibility is in order to prevent falls. And that's where what we've looked at for this project is right from health promotion through to that high-risk component. So what we're going to have do this morning is kind of walk you through these components of the model and then certainly share our successes for each of those components. Now, as we look at the community action plan, you'll see there that for the Kaiser Permanente, we've got health promotion as the foundation for our model. What we wanted to do is to ensure that the majority of our older adults who are healthy and well actually stay within that area of being healthy and well. And our model really is to look at the interventions that will help support an older adult at whatever level they are at, whatever risk level they're at, to actually cycle back to a lower risk level. So for the health promotion component, we're really looking at taking a population health approach to it. So looking at awareness and skill building and education, and also looking at engaging community partners to take action. So we started off with two community pilots, Owen Sound and Walkerton, and we engaged over 100 older adults to be involved in looking at their community, assessing the assets that their community has, and looking at where we would try and develop policies that would support healthy aging and age-friendly communities. And that's what we're really looking at for as we move on to year 3 is developing policies that will support age-friendly communities. We've held workshops for healthcare providers as well as family and friends so that we're supporting older adults within their homes to be as healthy as well as possible. And our social marketing campaign, what we looked at was to investigate a process or a system that would actually be one that gives a positive image to healthy aging, as well as looking at that whole wellness and well-being as well. So what we investigated was that within Alberta, they've done a whole study on a social marketing campaign called Keeping Balance, and we've looked at linking to that strategy, and so building on the evaluation that they've already developed. So as you'll see within our project, we've really emphasized the need to bring that research forward that's available within Ontario, within Canada, and seeing how that can be applied to our rural community. And for our community engagement, with the community forums, we did those assessments, and one of the successes that we had is we put an abstract in for the Grey Bruce Healthy Communities Conference that's being held on May 11th and 12th of this year. And the abstract was accepted, and so we'll be presenting at that conference. One of the other areas that we were able to link to was the EMS. And as I discuss the 6 warning signs in our next slide, I just wanted to let you know that EMS now is doing screening when they have an older adult that they're engaging in and picking up from a fall. So we've linked to that component within the community, as well as family health teams. The 6-point screen is now on their electronic record and being incorporated into their practice. For the community action, we actually have municipal leaders on our coalition, and one of the communities, Owen Sound, is investigating mapping where falls are happening and seeing what interventions that they have in place. Now, what we developed was a self-screening tool for older adults, when you look at that lower risk area, to make older adults aware of what were the critical factors that would identify them for being at risk. And so this is a self-administered screening tool, and what we've looked at is really ensuring that it's made available throughout Grand Group in all various locations. So not only community locations such as pharmacies, but also within family health teams, and wherever older adults are going to be, we're really trying to ensure that this is made available. So we've actually done it within health fairs, the seniors health fairs. This has been available to older adults there. We also wanted to make sure that it was available in a larger visual format. So this would be a format for those older adults who have a harder time reading at that 14-point font that we've got in that card. So those are the parts for the health promotion and lower risk screening area, and Sherry's going to continue on for the moderate and high.
Thank you. So the home support exercise program is for individuals who really are identified as moderate risk for fall. The home support exercise program, it is a research exercise program through the Centre for Activity and Aging in London. And it includes 10 simple exercises to help maintain or improve endurance, strength, and mobility. It is throughout grade groups, largely being conducted through two venues. So one is through the personal support workers through CCAC, and the other is through the community venues through VON through the SMART program. There is an evaluation with all of the components and all of the strategies associated with this project. So particularly with the home support exercise program, we have individual evaluations that include researched and validated tools such as the TNETIS, which is a competency scale. It assesses people's confidence with activities of daily living and mobility. Individuals also do HUD testing. It's like a timed up and go from a sitting to a standing position. And we also have individuals record a false diary, so that pre and post coming onto the program, we can see what their frequency of falling has been, as well as record what has been their frequency of exercising. That information gets channeled back to the coordinator of the program through the group health plan.